Good morning, everybody. Welcome to this meeting of the Government Contracts Committee. I hope I see some smiles out in the gallery there. Again, we're trying to do the people's business this morning. The first item on the let's see here. I think we do have a quorum. So, Clerk, would you please call the roll?
Senator Meredith.
Present.
Senator Richardson. Senator Thomas. Representative Ballman.
Present.
Representative McCool.
Here.
Representative Rourks.
Here.
Representative Petrie.
Here.
Representative Hart.
Here.
Chairman Douglas.
Present. We do have a quorum, and so we are duly authorized to do business this morning. The first item on the agenda is consideration of the minutes of the July 8th meeting of the committee. Is there a motion that we consider these minutes approved? Okay. You right. Okay. We have a motion by Representative Ballman, and we have a second by Senator Richardson. Clerk, please call the roll.
Senator Meredith.
Oh, present. Whatever.
That's a yes.
Senator Richardson.
Or-
Senator Thomas. Representative Bowman. Representative McCool. Representative Rourks.
Yes.
Representative Petrie. Sorry.
No, no.
Good morning. See, I need to sit by Meredith.
Representative Hart.
Yes.
Chairman Douglas.
Aye. Motion carries. Motion carries. Total number of items on the agenda today are 201 items in the amount of $88,653,611.89. All vendors are registered with the Secretary of State's office. Well, almost all. Next is the deferred list from July 2025 agenda. The first item is with the Kentucky Education Television, and it is number 28 on the July routine Public Service Commission green list. The vendor is still not registered with the Secretary of State. So, do I hear a motion to defer the contract to the September meeting?
So moved.
I have a motion by Representative Hart or Co-Chair Hart. Do I hear a second?
Second.
A second by Senator Meredith. All those in favor vote aye. All those opposed say no. Clerk, please call the roll.
Senator Meredith.
Aye.
Senator Richardson. Senator Thomas. Representative Ballman. Representative McCool.
Yes.
Representative Rourks.
Yes.
Representative Hart.
Yes.
Chairman Douglas.
Aye. Motion carries. The next item on the deferred list is with the University of Louisville. It is actually number 118 on the July PSC Amendment Ivory list. The university is actually requesting to defer this contract again to the September meeting. They're asking our committee to do that. Do I hear a motion to defer this contract to our September meeting?
So moved.
We have a motion by Co-Chair Hart. Do I hear a second? I have a second by Representative Bowman. All those in favor will say aye. All those opposed will say no. Clerk, please call the roll.
Senator Meredith.
Aye.
Senator Richardson. Senator Thomas. Representative Ballman. Representative McCool.
Yes.
Representative Rourks.
Yes.
Representative Hart.
Yes.
Chairman Douglas.
Aye. Motion passes. The next item on the deferred list is with Behavioral Health Development and Intellectual Disabilities, and it's actually number 7 on the July routine memorandum of agreement pink list. Do we have any representatives here? You would make yourselves comfortable. I always ask that people actually pull the microphone a little closer so that and then make sure the green button is on so that we can hear you. Representative Baumann and myself have questions regarding this.
Thank you, Mr. Chairman.
Oh, well, before we do that, my bad. Would you please identify yourselves for the record?
I'm Dr. Patty Clark. I'm the Director for the Division of Mental Health within the Kentucky Department for Behavioral Health, Developmental, and Intellectual Disabilities.
Good morning. My name is Sarah Johnson. I'm the Director for the Division of Substance Use Disorder within the Department for Behavioral Health, Developmental, and Intellectual Disabilities.
Thank you, ladies. If you would, just please raise your right hand. Do you solemnly swear to tell the truth, the whole truth, and nothing but the truth this morning?
I do.
Thank you. Thank you very much. Now, Representative Ballman, I'll let you start off.
Thank you, Mr. Chairman. And I noticed in my notes here that in 2017, 7 counties filed for Chapter 11 bankruptcy in order to avoid paying their portion of the KERS pension costs. The Supreme Court, however, has ruled that 7 counties must pay that $130 million they owe the state. So they owe the state tens of millions in pension obligations to the Commonwealth. So why are we entering into contracts for millions of dollars with 7 counties when they already have a multi-million-dollar liability with us?
As Kentucky's designated behavioral health authority, DBID, is required by statute to contract with 7 county services as a state designated community mental health center. They provide services for Jefferson, Bullitt, Henry, Oldham, Shelby, Spencer, and Trimble counties, and ensure access to the core safety net behavioral health services such as crisis response, outpatient care, and case management. While 7 counties does have outstanding obligations to the KRS, it is the sole provider of these statutorily mandated services in its region, and discontinuing that contract would jeopardize the care for thousands of people. Maintaining the contract ensures continuity, local responsiveness, and compliance with state and federal expectations for quality and accountability.
So can you explain to us also, I appreciate that response, but can you explain to us also how you came up with the funding split? So why is the contract so lopsided with general fund dollars?
Can you explain what you're...
Yeah, I don't have the contract in front of me directly here, but I have in my notes that the contract is lopsided with general fund dollars, and wanted you to explain how you came up with the split.
Well, it's based on the services that are provided and based on the population. All of our allocations are made. It's based on the population of the region, the number of services provided, the quality, et cetera. And we do have quite a few funds that go in that region for what's called homestead housing, which not just housing, but it's to divert individuals from law enforcement, incarceration, from residential services like institutions, et cetera. And so because of the higher population in that region, we actually have a higher percentage of funds that go to that region for that purpose.
Thank you, Mr. Chairman.
Thank you, Representative Ballman. Now, I have 2 quick questions. I probably will ask these same questions twice today. What's the purpose of the agency?
7 counties is a community mental health center that provides behavioral health services to.
I know what they provide. What is the purpose? I don't think that's a question we really ask ourselves. We provide a lot of services, but the question is simply, what's the purpose?
The purpose is to ensure that folks have access to behavioral health services in that community. So. Okay.
If I may, I know we keep numbers and we track the number of people that we're touching.
Correct.
Could you help me with the last time the number of people on the annual schedule has gone down?
Well, I can tell you that we served 24,500 people in the 7 counties region in state fiscal year 24.
Okay.
We do not have the final 25 numbers at this time. They have not been certified as we're.
If I may, and I apologize for interrupting you, but have the numbers ever gone down?
Yes, numbers fluctuate up and down all the time depending on the needs in the region.
On a yearly basis, or just on a short-term basis? Because I guess what I'm looking at, if our purpose is to help communities, at some point we should start seeing a decrease in number of people who require those services. And I'm just trying to get to the point where, and I'm not trying to be difficult, truly. The taxpayers are funding this. These programs are meant to help those people who are in crisis or who are in a particular situation, to help them get out of that situation, become role models in the community, therefore teach those coming up behind them not to be in this situation, which would ultimately suggest that at some particular point in time that we would have repetitively decreasing numbers.
Absolutely. I hear what you're saying. Thank you. Yes, we are seeing a decrease in the numbers of people served through 7 counties, but we also see a higher acuity of those who are served by 7 counties. So as we do address the needs, that reserves these services by our safety net providers for those who are at the highest need and are the least likely to be able to access services in other places. And so as we are able to grow the ability to cover those services, we do see a decrease, but we also have a higher acuity of folks being served.
Explain what you mean.
By higher acuity?
Yes.
That means that people need longer term services. They need more intense. They have complex cases. They may have co-occurring disorders. They may have both mental health, substance use, other eating disorders, other kind of things co-occurring at the same time. There may be physical health conditions that need to be addressed. And in order to make sure that they have appropriate services and have the best chance of becoming well, we address the need of them.
Okay.
Across.
That suggests to me that we may need to take a look at how we offer those services and what services we offer if we're having people having increased comorbidities.
Absolutely.
Because that is, in fact.
And we do that, yes. We
Okay.
are.
All right. Well, thank you very much. Any other questions? Representative Petrie?
Thank you, Mr. Chairman. Do you have a decent estimate of what the unfunded liabilities are of 7 counties in the bankruptcy case that was referenced?
I do not.
Any idea whatsoever aside from what Representative Baumann just related?
I do not.
Is there anyone in the contract process or inside the state agency that has attempted to determine that amount and then look at that as a direct subsidy into 7 counties to ascertain the extraordinarily high cost of delivery of services in that region?
Okay.
Sure.
I was getting ready to look for you.
Before you speak, if you would, please introduce yourself.
Absolutely. Hi, Wesley Duke. I'm the General Counsel for the Cabinet for Health and Family Services. It's good to see you all this morning.
Raise your right hand.
Yes, sir.
Solemnly swear to tell the truth, the whole truth, and nothing but the truth?
Yes, sir.
Okay, proceed.
So yesterday, just a little history lesson of this bankruptcy and everything yesterday. And in fact, their bankruptcy is still ongoing. They're still active in the Western District. It's the amount is approximately $20 million, I think, is what is being argued over. So it came back from the federal district court, came back to bankruptcy court, and they are and the plan is being disputed there. So you got about $20 million that's in question here as of yesterday.
Understood, and I've talked with multiple attorneys on the matter, and I think 20 is on the very extreme low estimate. I think we're considerably higher, and it's going to be what's going to be the reasonable cost. And in fact, I think they're having an extraordinarily hard time determining what the actual unfundeds are because of the methodologies that are used to determine.
It definitely appears that that's the case.
Yes, and we do have 2 APs that have been resolved, and we're still back in, but this case is setting fallow at this point. It's not moving unless there was an event that really moved it yesterday.
Nope.
It's still fallow and setting there, and we have building unfunded liabilities all the time. Those dollar figures should be added back into the consideration of what's going into 7 counties to deliver those services, which ups the cost, which brings me to the next question, if I may. Has there been anything explored of could we possibly find another company that could render these services, or is it possible the state could render those services itself? Now, state rendering could be expensive, but when you add in the unfunded liabilities that we're subsidizing into 7 counties, we could probably have done it cheaper ourselves from the get-go. Anyone explored those 2 things?
As far as what the department and the cabinet has done, I do not think they have. I do know, once again, we've had a long-standing contractual relationship with 7 counties, and they have a fairly substantial provider network. But at the same time, I don't know if those conversations have been had. But at the same time, I don't know why they couldn't be explored.
Right along the same tack, in negotiating a contract, has there been any thought to how could we start to recover some of the unfunded liability that's out there? Offsets of any sort?
And I don't have that information here today, Representative Petrie, but we can definitely go back and see where we are on that and provide an update to the committee.
Be great. And I think last, if I may,
Yes, proceed.
is this: we contract for services by statute that are made necessary for delivery. Are there services in this contract that are not required by statute?
I'll defer to you on that one.
I don't believe so. I think that all of the services have been determined that they are needed to meet our statutorily requirements.
Yeah, I want to make sure needed to meet a requirement or required can be two different things. Okay. So when you start getting over to certain housing issues and certain other issues that were just mentioned today, I would have to go back and check what I previously checked, but are these required by statute? Because in some senses, it makes no sense for state government to be involved with an entity for anything absolutely no more than what is required by statute, with very low estimate of $20 million unfunded liabilities that the state has been subsidizing and will continue to if this case doesn't work out and we don't work out an agreement. Why would we go any further out on a limb with them than we absolutely have to? Because they've already cut it off on us once. So if it's anything further than absolutely statutory necessary, then we're too far. Thank you, Mr. Chair.
Thank you, Representative Petrie. Well said. Senator Meredith has a question.
You know, an often cited statistic is that 60 to 75% of healthcare issues are based on social determinants. Do you think that's appropriate for the services offered by 7 counties as well?
I think there are multiple factors that play into that serve as risk factors or protective factors in the populations that are in 7 counties service area. And just like they do in all regions of the state, they can play a role, yes. But they're not necessarily the only.
So that was a yes. You kind of lost me in the explanation, but that was a yes.
Sorry. Yes, and there are multiple factors that play into the need for a person to need behavioral health services. And
sure. Again, we said 60, 75%. So obviously the rest are based on other determinants. Right. So here's I pose a question: is Chairman Petrie and I are both on the Medicaid Oversight Advisory Board and struggling how to fund for those services. And one thing concerns me, if communities are not actively trying to address those social determinants of health, then what role do they play in increasing the demand for these services? And this goes back to the earlier question about the funding, 35% federal, 63% general fund. That seems substantial. There's also agency 0.62. Is that from grants that the 7 county receives, or where's that funding come from?
I would need to go back and look at their contract specifically to be able to tell you that, but I can do that.
I'd like to know, because again, if you're on the verge of bankruptcy, but you're putting funds into this, and it just
yes.
kind of counterintuitive. But the reason I pose these questions is it's not picking on Louisville and Jefferson County, but if communities are not actively trying to address those social determinants of health, then should the state be totally, 63% responsible for the funding for these services? And I wonder if it's unreasonable, Chairman Petrie, as we're getting ready to do the next budget, whether Metro Louisville shouldn't be contributing to some of this cost and not just the state. So, and that wouldn't be just for this particular contract, but any that involves health care. We're not addressing those social determinants of health. So that's all I have, Mr. Chair.
Thank you, Senator Meredith. I believe Senator Thomas does have one more question.
Thank you, Mr. Chair. And tell me your name again, please, ma'am.
I'm Patty Clark.
Ms. Clark. Seven Counties has been around for quite a while now. Am I correct about that?
That's correct, about 55 years.
Okay. And this is a regional service that's provided by the state, very similar to what we provide in other regions. I think in Lexington, we call it bluegrass, mental health, and mental retardation, correct?
It's New Vista at this point.
New Vista, yes. Thank you. All right. And I, going back to Senator Douglas' point, I pretty much know what you do. And so my question is, if we didn't have these services provided by 7 counties, how would these services be provided to the residents in the 7 counties area? And that includes Jefferson County, right? Jefferson County and the contiguous counties like Shelby, like Oldham. I think Spencer would be one of those. Bullitt would be another. Mm-hmm. Who would provide these services?
Well, at this point in time, we do not have a sufficient number of providers who are outside this network, community mental health centers, that would provide these services. We would see folks who are un or underinsured, not being able to access mental health services, behavioral health services, as a result of not having these providers in place across the state.
And if I may, this provider.
And tell me your name, please, ma'am.
I'm sorry, Sarah Johnson.
Yes, Ms. Johnson. Please go ahead.
The 7 counties offers a whole array of services. So while there's a lot of treatment providers that may offer one specific modality of treatment, they don't offer all to address all the needs of the community, like 7 counties does.
Okay. Now, there's been mention, and excuse my ignorance here, there's been mention of a bankruptcy that's taken. Is that a bankruptcy that's been filed by 7 counties? West?
Yes, Senator. Yes, this is 7 counties bankruptcy. Yes, and I don't know. I can't remember the exact date that it was filed, but it has been ongoing for several years.
Okay. And Mr. Dukes, is this a result of lack of funding, poor management? What's been the cause of this bankruptcy?
Well, I don't want to speculate on 7 counties' internal workings, but it appears that, and this is going back, a little history lesson here, that
I love history.
When they, and some folks in the room may have been aware of some of this stuff too. So when they left or attempted to leave the Kentucky retirement systems, that was being contested, and their ability to do that. And for almost a 2-year period, they did not make their retirement contributions.
They being 7 counties.
They being 7 counties, okay. And that led to the amount, which is, like you said, somewhere in the 20 million or maybe higher amount. So it's for almost a 2-year period, they did not make their required contributions, and that's the contested amount. Now, the decision making behind that, once again, I'm not privy to those decisions, but it was a decision by them not to do it for whatever reason.
So the bankruptcy is primarily a result of lack of payment or non-payment of retirement contributions to one of our retirement systems.
Yes.
I don't have any further questions.
Thank you, Senator Thomas. First of all, I want to thank you all for joining us this morning and the seriousness with which the seriousness that we take in reviewing these contracts, and the seriousness that we have expectations, not just of those people who are providing the services, but the seriousness where we've really got to start taking a look at those people who are receiving the services and looking at the guardrail and see if they're meeting those guardrails to decide whether they wish to participate in these services. Just because we can provide them doesn't mean people want to participate. And as we all know, this money doesn't just come out of the ground. It comes from hardworking people in the Commonwealth and hardworking people across this country. And at some point, we're going to have to come to the realization that there are people who want to participate and people who don't want to participate. As sad as that sounds, we're going to have to start having some of those discussions. But with that being said, who's got a question? Oh, Representative Petrie has one more question.
Thank you. I just want to go back to an earlier point. If the chairs are good with it, I know we had mentioned exactly what services are in the contract, and if there's anything past absolute requirement by statute, can that be delivered back to the committee? Are y'all willing and able to do that? You'll need to say yes or no, I'm sorry.
Yes, sorry.
Thank you very much. Thank you, Mr.
Thank
Chair.
you. Senator Meredith.
Brief question, how much was the previous contract?
I believe it was within $10,000 of this amount, maybe even higher. This one's lower than last year's.
So nominal increase
Yeah.
this period?
No,
Okay.
decrease. Nominal decrease.
Okay, thank you. Thank you.
All right. Do we have a motion to consider this contract reviewed without objection?
Mr. Chair, given Chairman Petrie's comment about the scope of services provided, would it be appropriate to defer this contract for another month until we have that information?
I do not hear a motion to consider the contract reviewed, but I do hear a motion for deferral. Okay. We have a motion by Senator Meredith, and we have a second by Senator Thomas to defer this contract to our next meeting. All those in favor vote aye. All those opposed, no. Clerk, please call the roll.
Senator Meredith.
Aye.
Senator Richardson. Senator Thomas. Representative Ballman. Representative McCool.
Yes.
Representative Rourke.
Yes.
Representative Hart.
Yes.
Chairman Douglas.
Aye. The motion for deferral passes. Thank you all very much for your time this morning and for the information. We certainly will be looking forward to receiving some of the information that Representative Petrie has suggested. And thank you, Representative Petrie.
Thank you.
Thank you.
You may. The final item on the deferred list is with the Department of Community-Based Services. It is number 7 on the July Memorandum of Agreement yellow list. If the representatives are here, would you please come to the table? Again, if I may, I'd like to remind you to make sure you pull your microphones a little closer. We want to be able to hear all those wonderful voices. And if you will, introduce yourselves for the record.
Dr. Jennifer Thornhill, I'm the Assistant Director for the Division for Prevention and Community Wellbeing within Department for Community-Based Services.
Good morning, Jamie Tipton. Good morning, Jamie Tipton. I'm a specialist on the Division of Community-Based Services.
Good morning, I'm Charity Roberts, and I'm the branch manager in the Prevention and Evidence-Based Practices branch.
Well, good morning and welcome to the committee. If you would, please raise your right hands. Do you solemnly swear to tell the truth, the whole truth, and nothing but the truth?
Yes.
Yes.
Thank you very much. Cohort Chair has some questions.
Thank you, Mr. Chair. I'm curious, why isn't DCBS able to provide these services in-house? And I'm also was wondering why Youth Villages in Memphis, Tennessee was the chosen.
Yeah, so I can answer both of those.
Okay, great.
So this Youth Villages Intercept program is a Title IV prevention services program, so it's funded under that Family First Prevention Services Act. Requirements for that act for claiming to access those federal funds, we have to use approved evidence-based practices on the clearinghouse. We have to use half of those that are well-supported interventions. So Intercept is one of 20 of those interventions now that it's on the clearinghouse, so not a tremendous amount to select from, to try to consider family needs and outcomes that we want to achieve in selecting those and getting those approved on our federal plan. So Intercept was selected for that reason, in addition to their ability to bring a clinical focus of intensive in-home services to keep children safely in their home, and then also to provide an additional layer to offer foster care stabilization to help youth step down, which provides cost savings, and then also family reunification. And then in terms of Tennessee, so this program is out of Tennessee. That is where the purveyor is, so that is where we can access them. Now I can say they have leadership in Kentucky. We have brick and mortar offices in Louisville and Lexington, and then these services are provided in the homes, in the communities across all of the counties and all of the regions across the state. So there are staff across the entire state living in those communities to serve these families.
So they're more or less just headquartered out of Memphis.
Correct.
Okay. Another question. All these children are covered by Medicaid. Can you explain why we would need the additional funds? Or am I wrong on that, or about the children being covered under Medicaid?
I think children could be covered under Medicaid that are served through these services. I cannot answer if Youth Villages bills Medicaid specifically for what they can bill Medicaid. So typically that is a requirement in our contracts for Family First Prevention Services that they can bill Medicaid for as much as possible, and that our contracts would be what is the non-billable. So that is typically the standard, and I could verify that and provide that information back.
Oh, that would be great. That's all I have, Co-Chair.
Thank you, Co-Chair. Thank you, Co-Chair Hart. I think that was a wonderful question. I think that's a question that we are going to be asking a lot for those who will be coming in front of the committee in the future, just to let you know.
That's pretty.
Representative Petrie also has a question.
Thank you, Mr. Chair. Just to follow up on that, and make sure I put as fine a point as I can, we have pretty decent numbers in Kentucky of all kids that are covered under KCHEP, a type of Medicaid. And it looks like, if I had to take a guess, the coverage populations, the similarities between this set of services and the KCHEP especially, would be very high percentage. And I understood in what you said that they can bill for that. Do we require that they bill for everything so that we can make an offset?
So typically within any tertiary prevention service or any Family First prevention service, the contract language includes that we're using the contract as the payer of last resort, including accessing those federal funds. So I can go back and confirm that and provide that information back and dig into that.
Please do so, because it strikes me a little counterintuitive that we're increasing the federal funds, and this maybe it all comes out in the wash in the end. But we're looking to increase the federal funds, increase the amount of the contract considerably for a population that is probably already high 90% coverage of Medicaid. And it doesn't seem there's something there's a disconnect for me in there.
Yeah, I'd be happy to go back and find out that information, and then specifically the addition of funds. So this is to increase the numbers of family serving. So Intercept has pretty high success rates and outcomes of being able to keep the children in their homes safely, which of course keeps them out of our foster care system. And then, let's see.
And if I may, that leads me to the next piece. Is there any kind of performance measurement on this? So for instance, but for a contract of so many tens of millions over a 2-year period, we would have maintained level of services at a higher level. But because of the contract, we have a certain number of children who are receive lesser services, lesser severity, they're pulled down. We're intercepted successfully. Do we have any way that we're measuring that or getting feedback on it or a part of the contract, or nope, just render the service and you get paid?
And then in terms of the outcomes and monitoring.
Yes.
So of course there's contract monitoring. Typically in our contracts, I can verify for Intercept, we require 80% or more are in their home, remaining safely in their home at the completion of services. So I can check on that. So presently, we have over, I think, 83% living in their home at closure. And then in terms of recidivism, as time goes on, at 6 months, 81%, at 12 months, 79%. So pretty steady in terms of being able to continue that and longer down the road. I'll also share, so also increasing. The intent is increase services, so the demand for services is there. So right now, serving at maybe under 200 youth a day. So the goal is to meet 300 youth serving every day through this increase, and then also to access services in our Eastern Mountain Service region. So I'd mentioned that they're statewide, and they have staff in all communities. So started serving in Eastern Mountain, and this contract allows us to fully go into that region in the eastern part of the state where there's some limited services, and especially in terms of prevention of entry into foster care.
Yeah, and this is a difficult question, and I'll finish up if that's okay.
Proceed.
It's a difficult question, but what I'm after is the sine qua non, that without which. So if we didn't have this contract, what would we be getting? Now that we have the contract, what is the palpable difference? So what are we actually getting? Because otherwise you could just have a contract that renders services that we would have basically had the same result regardless. It would have happened some other way. So I'm looking for that special value that's added in by putting this contract out there and rendering that service. That is a difficult thing to do, if not sometimes near impossible, but that's what I'm after.
Okay.
That without which.
And if I think I'm understanding the question, correct me, and you can stop me if I'm wrong. So at the end of each state fiscal year, so those 81% of children, so we're serving about 300 children a day, those children are staying in their homes. So the cost for this service is about $12,000 per child. The cost for a child that's in foster care is right now, for the average length of time in foster care, is at a little over $64,000.
Yep, if you can detail that out, that would be great. If you don't mind, I'll go back and forth a little bit with you over time just to make sure we're getting as far along in the data as we can.
Sure.
Thank you, Mr. Chair.
Thank you.
Thank you, Representative Petrie. Senator Meredith does have one more question. One more follow-up.
I'm curious about the financing. It's all federal funds, but we're looking at a close to 80% increase in those funds. Is that already been secured, that funding?
So this is part of the specific state general fund appropriation that we get for Family First Prevention Services. So coupled with the 50% for reclaiming.
So is it one of those, if you don't spend it, you don't get it?
Yeah. Yes.
With the current environment in Washington of clawing back funds, is this funding in jeopardy for the next budget cycle? Because this just goes through 26.
I am not aware that Family First Prevention Services is in jeopardy. It was signed under current administration in 2018, or the previous administration.
It's something I would encourage y'all to watch very closely, because I'm really, I don't know, shocked or pleasantly surprised that you can get this kind of increase in federal funding, particularly in today's environment. So, thank you.
Thank you.
Thank you, Senator Meredith. With that being said, please understand one of our main concerns is duplication of services, whether it's duplication within the Commonwealth itself or whether it's duplication of services within the Commonwealth and contrasted with federal funding. Okay, and we really want to take a real hard look at, are we duplicating services? One of the things I got a little concerned about was the goal of serving 300. Well, it's great if there's a goal of serving 300 if 300 really need it. But we don't want to serve 300 just because we can serve 300. We want to serve 200 if they really need it. And then the others are learning to use their talents to improve their environment.
Sure.
So I just want us to be careful in how we approach that. With that being said, do I have a motion to consider this contract reviewed without objection?
So moved.
I have a motion by Representative Hart, Co-Chair Hart. Do I hear a second? Okay, I have a second by Senator Richardson. All those in favor, vote aye. All those opposed, say no. Clerk, please call the roll.
Senator Meredith,
I'm going to pass on this one, Mr. Chair.
Okay.
Senator Richardson, Senator Thomas, Representative Ballman, Representative McCool,
Yes.
Representative Rourke,
Yes.
Representative Hart,
Yes.
Chairman Douglas.
I'm going to pass on this as well, but the motion carries. Thank you so very much for we don't mean to be mean. We know that you guys are the experts in this particular space, and we're trying to become. So some of the questions that we ask may seem a little bit abrasive at times. We don't mean that at all. We just have a limited amount of time to gather information. So thank you also very much this morning.
Thank you.
The next order of business is consideration of the agenda, including the personal services contract list, personal services contract amendment list, memorandum of agreement list, memorandum of agreement amendment list and the deferred list, except for those items selected for further review. Do I hear a motion to consider these contracts reviewed without objection? So moved. Have a motion by Senator Meredith. Second. Who's that? Okay. I have a second by Representative Rourke. All those in favor say aye. All those opposed say no. Clerk, please call the roll.
Senator Meredith.
Aye.
Senator Richardson. Aye. Senator Thomas.
Aye.
Representative Ballman.
Aye.
Representative McCool.
Yes.
Representative Rourke.
Yes.
Representative Hart.
Yes.
Chairman Douglas.
Aye. Motion carries. The first item on the pulled list is with the University of Kentucky, and it's number 27 on the PSC, on the routine Public Service Commission green list. If the representatives are here, please identify yourself. First of all, just come up to the table, identify yourselves for the record, and take a deep breath. Please identify yourselves.
Good morning, Jennifer Fraker, Director of Government Relations at the University.
Good morning, Barry Swanson. I'm the Chief Procurement Officer for the University.
Okay. Thank you both so very much for being here. Could you please raise your right hands? Do you solemnly swear to tell the truth, the whole truth, and nothing but the truth?
Yes.
Thank you. Thank you very much. I do have a couple of questions. I'm not quite as smart as some of the other people here on this committee. So I want to know what is meant by transaction and activation of services.
Yes, I can explain that. I would describe it as logistical support. These are there are multiple projects involved with this, two particularly. One for the Ag Research Building and one for the some work we're doing in PAVA and PAVA HA as part of the healthcare system in Lexington. This group will come in and help us. These are large projects, hundreds of thousands of square feet of facility where we're moving from one building to a new building. And so they'll come in and help us organize those projects. They'll coordinate those. They'll supervise those projects.
Organize the
move.
movement process?
Yeah, the movement
Okay.
process. This is a lot of scientific equipment, medical equipment. It's not things that you can just hire a moving company to move. You need to have specialized services in order to handle the project.
I've set up labs before. I realize that, but I realize that most of our public doesn't. And I just want to give you an opportunity to let them know it isn't like packing up your TV and moving it next door.
No.
That's right. And
No.
just to give you an idea of the scope on the Agricultural Research Building, it's 263,000 square feet.
Second question. They have better movers in Ohio than we do in Kentucky.
Obviously at this dollar figure, it has to be subject to a competitive bid. So this firm is part of our consultant pool of contracts that we've negotiated contracts with. We sent out 168 RFPs. We've got 73 responses, and we've got 36 contracts. Contractors under contract, and so then the departments, as work comes up, go to that pool and negotiate specific scopes of work, and that is how we do it. So yeah, I would love to do business with a Kentucky moving company, but that's in our consultant pool, this is the one that was deemed to have the best expertise and the most reasonable price that we were able to negotiate with.
Well, my overall question was simply going to be, do we have Kentucky companies that are within your list of movers for consideration?
I don't know if we have. I don't know is the answer for this specific subject matter. There are many in the consultant pool. I don't know for this specific, because this pool covers many different topics, and so I can't answer that topic or that question specifically. In the pool, yes, absolutely.
Okay, I just want to make sure if you would, I would like to have information to make sure that we are giving our Kentucky companies an opportunity to participate.
Yeah, absolutely.
I really want to make sure that we do that.
Yeah, we can do that. Glad to do that.
I have a question from Senator Meredith.
Not a question, just kind of an explanation as to, I think, what you're asking the question to begin with. contract description for this is provide funds for transition and activation services for the university. Services include integrated transition and activation planning and execution to align building delivery with operations and staff readiness, FF&E, technology implementation, and movement readiness and implementation. Well, what in the hell is that? And this is all we had to work with. So
Yeah.
that's why we had to pose the question.
No, I understand. It was a mouthful for sure, and but all of those services actually are part of the contract. So it's
I believe you, Barry. I got it. It's just a challenge to figure this stuff out when you get that kind of description, and that's all we have. But
Yeah. All we're asking is, look, we've got some really expensive stuff that needs to be moved, and we got to make sure they're not screwing up. So we want to make sure that we have a company who's going to do it, and not cost us more money, right?
That's correct.
Okay. Thank you. I really appreciate that. Do I have a motion to consider?
Motion on the contract.
Okay. I have a second by Senator Thomas. I have a motion by Senator Meredith. All those in favor say yes. All those opposed, no. Clerk, please call the roll.
Senator Meredith.
Aye.
Senator Richardson. Senator Thomas. Representative Bowman. Representative McCool.
Yes.
Representative Rourke.
Yes.
Representative Hart.
Yes.
Chairman Douglas.
Aye. Motion passes. Thank you also very much for
Thank
your
you.
time this morning, explaining some really simple things for you all that other people need to know as well. Thank you very much. Next items on the pulled list are with the Department of Community-Based Services, and they're number 1 on the PSC Amendment Ivory list, number 8 on the routine MOA Pink list, and number 5 on the Memorandum of Agreement for $50,000 and under gray list. But since these are different contracts, we will take them separately. We will start off with number 1 on the Ivory list. Yeah. If you would, I know you've been up here before, but if you would, please reintroduce yourselves.
Dr. Jennifer Thornhill, I'm the Assistant Director for the Division for Prevention and Community Wellbeing within the Department for Community-Based Services.
Charity Roberts, I'm the branch manager for Prevention and Evidence-Based Practices branch in the Division for Prevention and Community Wellbeing.
Okay. And having not left this proceeding, please understand that you are still under oath. Co-Chair Hart has questions.
Thank you, Mr. Chair. Y'all noted that you're all moving funds to pay invoices, and will this have an impact on your funds appropriated for FY26?
It will not. The funds that are being moved from 25 to 26 are a little over $200,000. Those are Family First Transition Act funds, so those are entirely federal. They're 100% federal and have to be used prior to October of 2025, so that we can continue that to utilize those funds.
Right, and it's a statewide contract, correct?
So this contract is specific to our Eastern Mountain region.
Okay.
Again, the region I mentioned earlier that is under-resourced.
All right. We get very general descriptions on what's going on. It says it underscores the importance of children growing up in families. Can you maybe just expand on that and just tell us a little bit more what this program does?
Yeah, so similar to the previous, this is a Family First Prevention Service, so specific to both family preservation and family reunification.
Okay, thank you so much. That's all I have, Mr. Chair.
You know, it's interesting. Those are the exact questions I was going to ask, and I don't know. I'm just an old country boy, but how we have to underscore the importance of children growing up in families. I'm sorry we're at that point, that we have to underscore to those people who are having children the importance of having children. But I guess that is where we are. With that being said, Representative Petrie, do you have a question?
Yes, briefly. Thank you, Mr. Chair. Is this that we have invoices that we think are going to be coming in FY26, and so we're just moving money forward so we can get it paid, or is it we had money available in 25 and 26, and if we don't use the 25, we might lose it, so we're going to push it to 26 and see if we can use it?
Correct. We would like to use it all.
The second one?
Yes.
All right. Thank you very much.
Thank you, Representative Petrie. Any other questions? No? What do you think? Okay. Well, we'll go ahead and go ahead and do a vote on this one. Do I have a motion to consider this contract reviewed without objection?
So moved.
Okay. I have a motion by Co-Chair Hart. Do I hear a second? I'll second that. All those in favor say aye. All those opposed say no. Clerk, please call the roll for number 1 on the PSC Amendment Ivory list.
Senator Meredith.
Aye.
Senator Richardson. Senator Thomas. Representative Bauman. Representative McCool.
Yes.
Representative Rourke.
Yes.
Representative Hart.
Yes.
Chairman Douglas.
Aye. The motion carries. Again, the second one is number 8 on the routine memorandum of agreement pink list. Thank you, ladies.
Thank you.
Thank you.
We're moving on to the second one. If you would, pull the microphone forward, make sure the green light is on, and please introduce yourself for the record.
Good morning. My name is Roger McCann. I'm the Director of Family Support within the Department for Community-Based Services.
Thank you, sir. Would you please raise your hand? Do you solemnly swear to tell the truth, the whole truth, and nothing but the truth?
Yes, sir.
Thank you so very much. Representative Hart, or Co-Chair Hart, actually has a question.
Thank you, Mr. Chair. I just have one. How will this program be impacted by the changes in SNAP regarding the eligibility provisions and the shift in cost to the state?
For clarification, this is the EKSEP. Yes, sir. So the HR1, aka Big Beautiful Bill, does not mention SNAP employment and training. SNAP employment training is not a food program. It is a workforce development program. Okay. So it is not mentioned in that bill at all. So at this time, we don't believe there will be any impact to it.
All right, great. Thanks. That's all I had, Mr. Chair.
Yeah, that's wonderful. Okay. Do I have a motion to consider this contract reviewed without issue?
So moved.
I have a motion by Senator Meredith.
Second.
And a second by Co-Chair Hart. All those in favor say aye. All those opposed say no. Clerk, please call the roll.
Senator Meredith.
Aye.
Senator Richardson. Senator Thomas. Representative Bauman. Representative McCool.
Yes.
Representative Rourke.
Yes.
Representative Hart.
Yes.
Chairman Douglas.
Aye. The motion carries. And thank you very much, sir.
He's got one more.
You've got one more. You're next up. Okay. And now we're looking at number 5 on the memorandum agreement list, $50,000 and under. Well, actually, it's the gray list. Co-Chair Hart again has a question.
Thank you so much. Can you tell us what's the SNAP outreach? What's SNAP outreach mean?
Sure.
Just make sure I'm not
yeah.
confused.
SNAP is the food program where people get funds on their EBT. Then there's SNAP E&T, which is EKSEP. That's the workforce piece. There was a SNAP Ed, which is a nutrition program. Now, that was affected by the Big Beautiful Bill. But SNAP Outreach is USDA funds that typically go through states to nonprofits that work with folks who are in need of food, and it gives an opportunity for them to educate and do outreach in communities about SNAP, about the nutrition, and about the workforce programs. So SNAP Outreach is literally an outreach program to help people understand and navigate the SNAP programs.
So it's more of an educational type of resource.
Yes, sir. That's correct.
Okay. And one last question. Is there any indication that this program will be phased out in the future?
We have none at this time, sir.
All right. Thank you so much. That's all I have, Mr. Chair.
Thank you, Mr. Co-Chair. Any other questions regarding this contract?
Motion on the bill.
I hear a motion by Senator Meredith and second by Co-Chair Hart. All those in favor say aye. All those opposed say no. Clerk, please call the roll.
Senator Meredith.
Aye.
Senator Richardson. Senator Thomas. Representative Bauman. Representative McCool.
Yes.
Representative Rourke.
Yes.
Representative Hart.
Yes.
Chairman Douglas.
Aye. Thank you so very much. The motion carries. Thank you very much for your information. The next item on the pooled list is with the Department of Highways and is number 34 on the Personal Services Contract Amendment Ivory list. representatives that are here, if you would just make sure that you're close enough to the microphone, make sure the green light is on, and if you would introduce yourself for the record.
Good morning. My name's Erica Drury. I work in the Division of Construction Procurement for the Transportation Cabinet.
Okay, please raise your right hand. Do you solemnly swear to tell the truth, the whole truth, and nothing but the truth?
I do.
Thank you so very much. Now, my question regarding this, explain to us alternative delivery services.
Sure. So a bulk of our construction program is design, bid, build, like we would normally do, low bid work. We design the contract, we put the project out for advertisement, and then contractors bid on it. But for some of our more complicated, larger projects, we utilize alternative delivery methods like design, build, progressive design, build, and construction manager, general contractor. This alternative delivery support services is for an owner's representative because we don't have the expertise in-house to manage these projects. They're here to help us with repeatable processes and keeping the project on schedule.
Two concerns I have in this whole area. Number one, we've got almost a 45% increase in the ask, and it's not from $29.95 to $50.
Right.
It's from, it's an extra $4 million.
Yes.
For alternative services. Help me with that.
Well, because the process is relatively new, the contract is new, and so we did underestimate the support services that we would need. But these contracts are, we just awarded a $150 million construction project that this consultant supported for us. It's important that we have the owner's reps on our side to be able to keep the contractors do the design reviews and review their schedules and risk mitigation. So we did undershoot, but we also had to apply for a grant, a federal grant, 3 times unexpectedly. We thought we would get it the first time, and we applied 3 times. That's under this contract. The I-65 Central Corridor project that they're supporting, one of the contracts they're supporting, is in downtown Louisville, one of our busiest corridors, and it's got 18 bridges that we intend to replace. So that's why it's necessary for us to increase these funds.
Chairman Douglas.
Oh.
I apologize. I'm Eric Pelfrey. Good to see you again. I'm out of
Hi,
state
Eric.
today.
Well,
How are you?
but before you speak, raise your right hand.
Yes, sir.
You solemnly swear to tell the truth, the whole truth, nothing but the truth, since we already know you.
Yes, sir, I do. Great to see you again also.
Great to see you. Great to see you.
If I don't mind, could I just add one point of clarification also? So Eric is talking about the contract that we have with WSP. We also have an identical contract with American Structure Point, and that contract is also a $5 million initial contract, and we're not even at 40% of that contract. So if you look at the entire breadth of the program, we expected $10 million, and we're right at about $10 million. So I completely agree. We're utilizing this